This segment of DelmarvaLife is sponsored by Peninsula Home Care.
If you are dealing with chronic illness, you already know it can be difficult to manage everything that goes along with that, whether it's doctor appointments or dealing with medications or side effects or just staying on top of all the aspects. It can be daunting.
Oh yeah, but luckily the folks at Peninsula Home Care have a solution to manage you through the many stages. And here to tell us more is Beverly White, Vice President of Operations. Beverly, always good to see you in historic Studio D. So chronic illnesses, chronic diseases, they're important to manage, correct?
Absolutely. So we know that when a patient has a long-term disease, such as a diagnosis of maybe congestive heart failure or COPD or diabetes, we know that over time and as people get older, they're going to have issues that arise. And there are going to be periods of time that maybe they'll be doing well for a longer period of time, but then they're going to have an exacerbation of their illness that they're going to have to address. So disease management is really important throughout their life stages.
So how does, if I'm saying this right, evidence-based disease management, how does that work?
Yes. So an evidence-based program is based on outcomes. So what we did, we started about 2 years ago looking at different programs, and we actually started with Tidal Health Peninsula Regional with Dr. Snyder to work at, our first look was at congestive heart failure. And we took a look at outcomes of programs that were evidence-based to look at implementing educational-based programs for different patients to see how we could implement that in the home over a 60 and 90-day period to try to help patients manage different stages of the disease, provide different education, different programming. Since then, we've added a COPD program under the same context to have a different educational program as well as a kit for those patients that includes a visit from our nurse practitioner and also a respiratory therapist to come into the home and do a respiratory assessment to provide additional education. We are in September launching our diabetic education program.
Wow.
Where they will have a nutritionist, a dietitian come in the home and work with them. We also have 4 of our nurses that are wound care certified. That way they can help them to heal their wounds, because we know that wounds tend to also be cyclical and come back periodically.
Yeah.
Obviously,
No two patients are alike, so
No.
these plans are personalized?
Absolutely, they're all very individualized. So when the nurse comes out at your immediate start of care to come out, they take a look at all of your history, and we work very closely with the hospital as well as with all of our community partners, physicians and other providers, specialists. We take a look at history, and we also take a look at when the last time you had an exacerbation of your illness. So we're hoping to really put this program back in place kind of pre-COVID. COVID changed everything for us. We know that during COVID, every referral for home care came from the hospital. Everybody had to almost go to the hospital when they needed services because offices weren't seeing patients. So now everything has changed. We're trying to kind of change that back to pre-COVID times.
Okay, so since you started all this, what's your feedback been like? What have you gotten back as far as return?
Exceptional.
Yeah.
Our CHF program, since March of 2023, we have enrolled over 400 patients community-wide, community including Sussex County of Delaware and the 3 lower counties of the Eastern Shore here, Wicomico, Worcester, and Somerset. And we've had a less than 1% readmission rate for hospitalizations.
Ooh, that's good.
That's what it's all about. Yeah.
So lots of positive outcomes, and we're hoping for the same kind of outcomes for our other programming as well.
That's wonderful. Love how you
Yes.
guys are all working together and coming up with this personal care.
Yeah, absolutely.
Beverly White with Peninsula Home Care. Thank you so much.
Yeah, thank you. I appreciate you having me.
Well, supporting our hometown heroes, one oyster sandwich at a time. Up next on DelmarvaLife, we preview an annual carnival that's helping to fund our fearless fighters.
And a little bit later on, they're big, they're yellow, and the wheels go around and round. We're going to share how important reliable transportation to our area schools is.
But first, let's check out the lineup on Delmarva Sports Network. Baseball is at 7 with the Myrtle Beach Pelicans taking on our Delmarva Shorebirds. And then the final score is at 10:30. For now, keep it here, where DelmarvaLife is on the way.